Hey everyone, welcome back to our podcast. I'm Liza, and this is our 6th episode. Today we're diving deep into gallbladder pain and gallbladder surgery, a topic that affects a lot of people, but is often misunderstood. And joining me, as always, is the amazing Dr. Moein. Welcome back, Doctor.
Thank you so much, Liza. It's great to be here. I'm looking forward to discussing this topic because gallbladder issues are more common than people realize.
Absolutely. Let's start from the very basics. Dr. Moein, what exactly is the gallbladder and why do people get gallbladder pain?
Sure, Liza. The gallbladder is a small pear-shaped organ located right under the liver. Its main function is to store and release bile, which helps in digesting fats. Gallbladder pain usually occurs when something interferes with this process. The most common cause is gallstones, which are solid deposits that form inside the gallbladder. They can block the flow of bile, leading to pain, nausea, and sometimes infection. Other causes can include gallbladder inflammation, infections, or rarely tumors.
So gallstones are the main culprit. How would someone know if they have gallstones? Are there specific symptoms?
Yes, the symptoms can vary, but the most typical one is sudden, intense pain in the upper right abdomen, often after a fatty meal. This pain can radiate to the back or the right shoulder, and people may also experience nausea, vomiting, bloating, or indigestion. Sometimes the symptoms come and go, which can make it tricky. But if the pain is severe or persistent, it's important to see a doctor immediately.
That makes sense. I think a lot of people confuse gallbladder pain with regular stomach pain or acidity.
Exactly, Liza. That's why proper diagnosis is crucial. Often, an ultrasound is the first test we recommend because it's non-invasive and highly effective in detecting gallstones or inflammation.
Now, when it comes to treatment, when is surgery actually necessary?
That's a great question, Liza, and this is really important. So I want everyone listening to pay close attention. One of the biggest messages I try to highlight is this: do not delay gallbladder surgery once you start experiencing recurrent gallbladder pain. When gallbladder pain keeps coming back, it's not just uncomfortable, it begins to change the anatomy of the gallbladder. The organ becomes inflamed, distorted, and much more difficult to remove safely. A surgery that normally takes less than an hour and is simple and routine can suddenly turn into a very complicated procedure with significant risks. In some cases, delaying surgery can even lead to life-threatening complications. And the sad part is many people delay surgery because of fear or cost. But the truth is, when gallbladder surgery is done early, it's straightforward, safe, and often less expensive overall. So my advice is simple. Don't let fear decide when you should get surgery. Even one gallbladder attack is considered a clear indication for surgical removal. Early treatment leads to the best outcomes.
And there are different types of gallbladder surgery, right? Could you explain them?
Absolutely. The two main types are laparoscopic surgery and open surgery. Laparoscopic surgery is minimally invasive, involving 3 to 4 small incisions and a camera to guide the procedure. And this usually means less pain, shorter hospital stays, and quicker recovery. Open surgery involves a larger incision and is reserved for complicated cases such as severe inflammation, scarring from previous surgeries, or if there's a risk of injury to nearby organs.
That's really helpful. Now, a question that a lot of our listeners might have, is there a minimum age for gallbladder surgery?
Well, technically, gallbladder surgery can be done at any age if it's medically necessary. That said, it's more common in adults aged 30 to 60 because gallstones develop over time. In children, it's rare but possible, usually due to underlying medical conditions or genetic factors. Older adults can also safely undergo surgery, though we carefully evaluate their overall health before proceeding.
Got it. And what about costs? I know that's a big concern for many people.
Costs can vary depending on the hospital, surgeon, and type of surgery. Laparoscopic surgery is generally slightly more expensive upfront, but because recovery is faster, it can save money in the long run. Open surgery may have lower surgical costs, but longer hospitalization and recovery time. Insurance coverage and location also make a difference, so it's best to check with your provider.
That makes sense. Let's talk about recovery. After surgery, how long before someone can go back to normal activities?
For laparoscopic surgery, most patients can resume normal activities within 1 to 2 weeks, although heavy lifting should be avoided for a few weeks. Open surgery has a longer recovery, around 4 to 6 weeks. Diet-wise, initially patients may need to avoid fatty or greasy foods until the body adjusts. Over time, most people return to a normal diet without any problems.
So life after gallbladder surgery is pretty manageable?
Absolutely. You can live a completely normal life without a gallbladder. Your liver continues to produce bile to digest fats. Some people might notice mild bloating or indigestion after very fatty meals, but these issues are usually temporary.
And what about risks? Are there complications people should know about?
Like any surgery, there are risks. For laparoscopic surgery, complications can include bleeding, infection, or injury to the bile duct, though these are relatively rare. Open surgery has slightly higher risks due to its invasiveness. That said, gallbladder surgery is one of the most commonly performed and safest abdominal surgeries worldwide.
That's reassuring. Now, for people who might be anxious about surgery, what would your advice be?
I would say don't ignore symptoms and have a detailed discussion with your doctor. Understanding the procedure, recovery, and risks helps reduce anxiety. Early intervention often prevents complications like infection or pancreatitis, which can be serious.
Finally, any tips for maintaining gallbladder health before surgery or for people who want to avoid issues?
Sure. Maintaining a healthy weight, avoiding very fatty foods, and eating a balanced diet rich in fruits and vegetables can reduce the risk of gallstones. Staying active also helps, but if symptoms appear, lifestyle changes alone may not be enough. That's when proper medical evaluation is essential.
Thank you so much, Dr. Moein, for explaining all of this in such detail. I'm sure our listeners now have a much clearer understanding of gallbladder pain and surgery.
My pleasure, Liza. I hope this helps people make informed decisions and feel more confident about their health.
And thank you to our listeners for tuning in to episode 6. Don't forget to subscribe for more episodes where we answer your health questions. Stay healthy and take care.